Hi, Dr. Pizzella, and I'm here to talk to you today with our Ask the Doctor series. And today we're going to talk about painful sex, also known as dyspareunia. So a lot of women experience, and it's a very common problem to have painful intercourse. What we have to do is get to the root of the problem. And so many times women will come in, particularly menopausally, and they'll have changes that occur in the genital urinary tract due to the lack of estrogen. So adding back estrogen can be a simple solution to helping with vaginal laxity, elasticity, dryness, and overall vaginal health. So that could be one of the biggest problems, and if we can solve that, then they'll be fine. However, there are some women that suffer in our younger ager population with pelvic pain because of high tone or weakening or too tightening of their pelvic floor. We call this vaginismus. This is a issue where their pelvic floor muscles could be too tight, so it's difficult to have penetration. So we can use things like pelvic floor therapy. There are physical therapists that are trained to help downtrain those musculatures. There's also vaginal dilators to help separate them from the intimacy, using the dilators to help stretch the vaginal walls and help to tone down those pelvic floor muscles as well. There's also pain that you can have in the vestibule or the opening of the vagina, and that's called Vestibulitis, and that can be nerve pain. So we have to target the nerves to desensitize those nerve endings that are really overfiring and causing all that pain. So we use things like neuropathic medications that can desensitize the nerves. We can use numbing agents, also vaginal dilators, and pelvic floor therapy. So if you have any of these other issues with pelvic pain or painful intercourse, I'd be happy to talk to you about it. We'll set up a consultation and you give us a call or leave a comment down below.